All right, looks like we're live. Stefan Hartman, Iron DPC podcast, coming to you all with an amazing expert today, Dr. Melanie Joy. Thank you for joining us today.
Absolutely. Thanks for having me.
Glad we could finally connect. So, Dr. Melanie, explain a little bit about what you do, where your practice is located, your degree.
Absolutely. Yeah. So my practice is located in Pensacola, and I recently switched my practice to be completely virtual. So I was actually in office for 10 years, went virtual, absolutely loving it. And I am a holistic health specialist. I really like to use both the physical world of what's the root cause. Is it a infection, heavy metal, chemical? Is there an organ dysfunction? But I also like to combine the emotional component. So I have my PhD in Christian counseling so that I can offer those emotional tools that help when we're trying to, help someone go from symptoms to recovery. So I think it's kind of combining both of those. And what led me on that journey was my own health journey.
And when did that start for you? How did you get involved? Because we all have our story of how we go into like the holistic side of things. How did yours start?
Yeah, so basically when I was 21, I was diagnosed with a heart condition. And I had gone to so many different doctors to try to figure out why I was having chest pain at 21 years old and why I was having these episodes of feeling like I was going to have a heart attack. And no doctor could help me besides giving me another diagnosis and telling me that I was going to need to be on painkillers and anti-inflammatories for the rest of my life. I had absolutely no idea about natural medicine, alternative medicine. I didn't know anything about holistic health or anything, but I knew that I didn't want to have a diagnosis and I wanted someone to get to the root cause of the problem. So I started seeing natural doctors and I went totally into the natural world. I dove head first and I just started working with practitioners. And at this point, I was actually a teacher. I taught in Florida and I was working with natural doctors. I had taught for 2 years and my health completely turned around for the better. I reversed the heart condition. I went from feeling like I was dying to feeling like I actually could live and have energy. The chronic fatigue was gone. And at that point in my career, I either had to get a master's degree in education or reading or go the natural health route. That's when I took a U-turn and I got a master's degree in alternative medicine. So in studying the body and really understanding that everyone needs something uniquely personal on their journey, that basically the natural practitioners that worked with me, they personalized it. It wasn't like a Band-Aid protocol approach. They personalized it. So that's what I wanted to do with my practice. So right after I graduated, I found Yulin Nutrition Systems, which is Dr. Yulin teaches basically almost like a basic functional medicine, get to the root cause, except he teaches muscle testing. And when I was having my symptoms, many of the practitioners that I worked with used either muscle testing or blood work. And so I was pretty comfortable with muscle testing. And so they teach you how to muscle test and they teach you basically how to work with those sensitive cases. And I understood that because I was sensitive. You couldn't just put me on a protocol. I needed a very fine-tuned system. So I started doing that with my practice. I worked at a chiropractor's office, and then I had my own practice inside of an herb shop. And then a few years after I began doing nutrition response testing, I did a integrative and functional medicine nutrition course. That was an 8-month course with Susan Allen, and she is a functional RD. And she learned from Dr. Mark Hyman and Dr. Jeffrey Bland all about functional medicine. And she taught this 8-month course and it was life-changing. It was like combining everything in muscle testing and nutrition with this like functional medicine lens. And then, so I did that. I was about 5 years into my practice, and I myself went on my own emotional journey of working on my emotions, processing my emotions, understanding how my emotions affect my health. I worked with counselors. I worked with people that helped me with emotional freedom technique and tapping and using essential oils to release emotions, which emotions are affecting the organs. And so I wanted to apply that with my practice, because a lot of times I was ending up referring my clients, once we would get all the physical stuff cleared out, I would refer them to a counselor to work on the residual, like emotional stuff that was going on. And so I worked on my PhD in Christian counseling, and I'm currently working on becoming a somatic experiencing practitioner. So I will be done with that next year. And I'm also currently working on the CNS program, which is the Certified Nutrition Specialist, which is another path to licensure in the state of Florida. So I finished up my supervised hours in 2020, and I have 2 more semesters of coursework, then an exam, and then I'll actually also be a CNS. So pretty much I never stop learning. It's always for the betterment of my clients.
Yeah. Very cool. So this muscle testing thing is, I don't know if this is the same thing that I learned in PA school. What do you mean by that?
So basically we're using the body. The body already has determined whether a chemical or a food or an animal is good for your immune system or not good. The body's already determined, okay, this is going to be an issue. We need to get in the white blood cells going on. We need to create an inflammatory cascade. The body knows that before we consciously think about it. So in muscle testing, it's basically frequency testing, and we have test kits that have vials of different foods, infections, heavy metals, chemicals, organs. And when you place that on someone's body, their arm, your muscle lock, it's either going to lock or it's going to unlock. It's either going to be, your body's going to say yes or your body's going to say no. And I'll never forget the first time I experienced this when I was sick. I was seeing a chiropractor, and he was like putting his hand on all these different organs, and my arm stayed strong. And when he got to my stomach, my arm completely went weak, which of course, one of the main ways that I resolved this heart condition was by healing my gut, which no medical person would ever tell you that. They don't see how that's connected. But if your gut is inflamed, any other organ can be inflamed. Mm-hmm. So it was like seeing it firsthand, like your body is so smart. It's so connected. It knows what it wants. And we can do that with supplements. Does your body want this supplement, or is that not a good supplement for you? And that type of testing can be very detailed, because let's say I have 10 different supplements for the heart. Well, I'm going to test a person on all 10 of those. They might only need one of them. Or there's all the different herbal infection fighters. Let's say, I've got cloves and wormwood and black walnut. I'm going to test and see, does this person need this infection fighter? Now, it seems like, how does your body know that? But when you take what your body tests for and you recover, or my clients, when they recover, it's like, I get it. Like, my body knows.
Mm-hmm. Very cool. And your clients, what sort of clients do you mostly see? Do you see young women, older women, autoimmune syndromes? What's the typical patient profile for you?
Mostly women to start. They're going to be struggling with some sort of symptom, whether it's digestive, hormonal, skin, low energy, a lot of autoimmune cases. And then typically we work on them, and then they get their kids in, and then they get their husbands in. And so my practice, I really work with a lot of families. I work with a lot of, it's kind of the whole family unit, but the moms or the women usually get in first.
I find also in my practice, there's so much autoimmune disease in women. It affects women primarily, is what I found. Or maybe just men deal with it better. Or what is your experience? Is it mostly women that are affected by autoimmune conditions?
I do see that it is mostly women, and I think there's a big emotional component and a trauma component, that if there is trauma that's stuck in the nervous system, and let's say someone is stuck in fight or flight, their body is not healing. Their body isn't in rest and digest. So it's almost like their body has kind of been in a war zone, and their body has not had the time to replenish, rejuvenate, repair itself, rebuild itself like it normally would in rest and digest. And there's a lot of different techniques that support, resolving trauma, things like EMDR, or there's Psych K, there's somatic experiencing, even emotional release work or emotional freedom technique can help. There's a lot of different techniques. The natural doctor that I worked with, she did neuro emotional technique, and really Dr. Peter Levine explains it the best, that animals in the wild can go through extremely traumatic things, but they don't have the symptoms. Once, like a couple minutes, they shake off a trauma and they move on. And so he kind of teaches, like, if you still have that stored trauma, because we aren't taught how to release it, then that can affect your nervous system. That can affect your hormones, your gut, your peripheral nervous system. And it's amazing when you can watch someone, especially in natural medicine, because sometimes natural medicine, it sort of helps you get through the problem. Like, you think you're solving it and it's like, okay, I feel like I'm getting better, I'm resolving this. But there's a little bit of a residual emotion or trauma connection, and you need some support to help so that those symptoms don't return.
Yeah, I like that. And in psychiatry, when I worked in psychiatry, we would always have patients in cognitive behavioral therapy along with the psychiatric side. But we don't really see that outside of psychiatry in other parts of medicine. But what you're trying to say here is the emotional side of things it can affect every part of the system, right? We don't typically think of sending someone to the GI specialist, but also sending them to someone who can do, behavioral therapy. But that seems to be what you have found to be most powerful.
Exactly. The medical system it's almost like so separated. But I mean, I've literally watched people release trauma from their hands. And it's like, and it ends up affecting their whole body in the most incredible way. And it's not necessarily psychological. I mean, it's almost like physical, emotional. And sometimes it's like, we don't necessarily have to know the why. Like, okay, let's say you're working with someone's trauma and their hands start sweating. It's like, your body, it wants to release something, so I don't necessarily know the why. And I've been in working with the human body and trusting it. Typically, when the body has a symptom, it's trying to heal something, and we, in our minds, we think, oh, it's a problem, it's an issue. And typically the symptom can really help us heal you if we understand, like, what your body is trying to do.
Yeah, it's amazing. So you find, like, you have to, how do you approach it first? Do you first try to heal the gut first with dietary changes, or do you go more towards supplementation, or the therapy route? What is your first focus when you bring someone into the office? What's your kind of stepwise way of going about it?
I always start with the physical. So always start with the physical, because it gets too overwhelming if you try to do the emotional component first. So I always start with the physical. And then the first thing in nutrition response testing that we do is we test the nervous system. Because if someone is autoimmune, or they're overreacting or underreacting to supplements, I want to know what is affecting their nervous system, and I need to correct that first before I even get to the gut or the thyroid or the HPA axis, or if there's a hormone imbalance or whatever's going on. I always start with the nervous system, and I test the nervous system to see, is there any stressors? Is there a food sensitivity? Is there an infection? Is there a heavy metal? Is there a chemical? And then, based upon what I find with the nervous system, I start there. which really looks like changing someone's diet and opening up the detox pathways. And you kind of start this process. And then once we cover those bases, typically we're going to start either working on the gut or hormone balance or energy, low energy or HPA axis dysfunction, just depending on what they're coming in with. That's where my focus is going to turn to. But it's always basically the nervous system, opening up the detox pathways, dietary changes, stress reduction. Those are primary.
Mm-hmm. That's very interesting, the detox pathways. In conventional medicine, we say, well, the creatinine looks normal or your liver function test looks normal. You're fine. You don't need a detox. What do you say about that?
Yeah, so if they're having symptoms where they've got a skin rash or they've got some type of digestive symptom or they don't have any energy, we can pretty well determine that there's something going on, whether it's the colon, whether it's the kidneys, whether it's the skin, whether it's the gallbladder. We can pretty well determine what we need to support, especially based upon their symptoms, but also based upon their diet. If someone is lacking in very specific nutrients that support liver detox or that support gut health, their body is not going to be detoxing.
What would be a diet that would say, for example, support liver detox? What would that look like?
Absolutely. So any diet has to be personalized. So you're going to have both the plant foods and the animal foods that are going to be supporting liver detox. One of the first foods, if there's something going on with the liver, one of the first foods is actually liver. So if someone is not only low energy or symptoms of anemia or itching skin, we're going to see what's going on with the liver, but either taking desiccated liver capsules or cooking with liver. I know I have videos and try to teach my clients, if you don't like the taste, buy it already ground up from US
Yeah.
Wellness Meats, put
Yeah.
it in your ground meat so that you don't have to worry about the taste.
Yeah.
Those organ meats can change the organ. And sometimes I'll use herbs. Sometimes I'll use like milk thistle or beets or choline. It depends on the sensitivity. And it also depends if we've opened up the detox pathways, because I really want to start with food.
Yeah.
And supporting their detox.
Same. I'm a huge proponent of an animal-based diet and implementing the organ meats again. What's your favorite way to cook like a beef spleen, bison spleen?
Okay, so I don't know if I've had spleen, but I have had lamb, pork, and beef. Liver, I've had deer liver, heart, and kidney. And whenever I've had it whole, because I know hunters and they'll give it to me whole, I always grind it and add it to other foods. Now, there has been times when I've tried to cook, like fry it up the way my grandma did with like onions and bacon and like fry it up like that. Sometimes it can be a little strong. So I just try to either grind it myself or I buy the US Wellness Meats or White Oaks Pastures. They have a ground organ blend and I just mix it. I actually have a YouTube video where I take that pack and I mix it with ground beef, and then you pack it up in your freezer and you don't even have to worry about it. It's just in your food.
You don't even notice you're eating it. Although the other day I found that you can get the Primal Kitchen marinating sauce. So what you do is you chop up the spleen very fine, you marinate it for 2-3 days. You take it out of there, and I actually tried it raw, and it actually tasted pretty fine.
Really?
Yeah, it was not bad at all. But what I also do is I put some ghee or butter in the pan, and I'll fry it up maybe 30-40 seconds. Doesn't take much. That's pretty good too after a couple marinating days.
Wow. Yeah. With the animal foods, it's like there is a little bit of effort and sometimes work going into them, but the nutrition that you get in return, and on top of it, the standard American diet, the American diet is very low in minerals, especially copper and zinc. And those organ meats have the copper and the zinc, which is what we need. Our immune systems, our skin and hair health. And I think it's this is why I like a lot of your posts, because you share, like, you're feeding the chicken's liver, you're eating the organ meats. This is why I love it, because there's like this manipulation tactic going on to turn people onto the plants, and the plants are missing those fast soluble nutrients, and they're missing, I mean, we're not plants, we're like animals, we're not like a plant. So when we eat those foods, and especially in my early days of studying nutrition, reading Nutrition and Physical Degeneration by Dr. Weston A. Price, reading Nourishing Traditions by Sally Fallon, and just seeing, you can actually see side by side the people that eat a traditional diet that had animal foods, their teeth, their mouth structure, their immune health, just testing them, they look way healthier.
Way healthier.
They looked way healthier. And you can, not only that, you can feel the difference.
Yeah. Yeah. There's a lot of propaganda to support the New World Order plant-based agenda. But, you know, in mainstream science, nutritionists, RDs, it's a lot plant-based. And they're missing the mark a lot on that, mostly because if you just look at the way soil is tilled nowadays, that soil doesn't have the nutrients that we had 100 years ago. The carrot from 100 years ago is not the same carrot you have today as far as vitamins go. You know, it's just the fact of the matter is, and it's sad.
It's true. It's true. And it is sad that that is what they promote for everything. It doesn't matter if you're talking about colon cancer, if you're talking about heart disease, it doesn't matter. It's almost like they are so programmed to the plant-based. And when I was sick, when I had symptoms, the plant-based was not going to fly. Plant-based, it was like so irritating to my system. It was like, forget about it. When I switched to doing like broths, homemade bone broth, cooked veggies. I did do some raw juices here and there, but mostly it was those cooked foods and animal foods. That's really how I healed my system.
Yep. That's how you heal. Meat heals.
Mm-hmm.
Amazing. Yeah, another thing we need to bring up is the supplementation. So a lot of people out there, they're taking a lot of zinc every day because they're trying to protect themselves from COVID. But you brought up the zinc and the copper ratio, and a lot of people don't understand that these things, they come in ratios. And if you take too much of one thing, you're going to affect another thing. That's part of Chinese medicine, the yin and the yang. There's always a balance. And when we get things from the whole animal source food, it comes in the perfect complement balance. So what do you say to people out there trying to protect themselves from COVID and taking so much zinc and all these minerals?
I'm so glad you brought that up, because you're exactly right. You take too much zinc, you're going to imbalance the copper, and now you think you're supporting your immune system, and really you're essentially depleting your body of a mineral that it needs to support your immune system. So it's almost backwards. But yet they promote the zinc supplementation everywhere. And realistically, I would rather someone take, I think it's called Oyster Max, or I could just call them oyster caps. And they're basically like whole food zinc. And that whole food zinc capsule has a little bit of copper in it. And then, or beef liver capsules, or any organ capsule. Sometimes I'll recommend thymus capsules, or beef kidney, especially any of my clients that have hair shedding and they really need zinc. I will actually recommend beef kidney capsules, or if they'll eat the beef kidney. And basically what you're doing is you're getting the whole food ratio of the copper and the zinc, and that protects that mineral balance. And the mineral balance is so delicate, I feel, especially now, because there's so many chemicals and there's so many heavy metals in our environment that our body is almost constantly trying to balance what's going on in our environment, what's going on in our body. And when we can eat those whole food, this is where the war is. When we can eat the whole food animal source, we are going to increase our health. We're going to improve our health.
Yes. Yep. Yeah. So important. Yeah. If you can't stomach the organ meats, you get the desiccated capsules. They're a bit more expensive than getting like the real food source, but better than taking just a little tiny vitamin or this mineral or that multivitamin.
Exactly.
Yeah. How do you go about the heavy metals? Heavy metals are everywhere. I feel like they're very difficult and expensive to test for as well. Um, how do you really go about identifying those?
Yeah, so I don't like to use the traditional chelators. A lot of practitioners will use like the chlorella, the cilantro, the ALA. And what can happen with those chelators is that you're basically pulling or moving the metals, but you don't know if it's actually leaving the body. So if heavy metals show up in testing, what I like to do is support their detox. Let's get them sweating in a sauna. Let's get them doing a coffee enema or saltwater enema. Let's clean up their diet. And then let's see if they test for a binder. And there's all different types of binders. I mean, there's things like activated charcoal, bentonite clay. Cellcore makes some that have the fulvic acid and the humic acid. Sometimes my clients will test for a mineral as a binder. So like sometimes they'll test for silica, and that almost acts like a binder in their system. So I always first start with detox, and then do they need a binder? And then lastly, what minerals are they deficient in? And really what's going to happen is when you start giving someone minerals, their body is naturally going to chelate metals. So you need to have the detox pathways open first. Sometimes they need a really small dose. Sometimes they can handle a larger dose. It depends if they're like a fast oxidizer or a slow oxidizer. But realistically, if someone has heavy metals, they're deficient in minerals. And that process, it can be a little bit of an up and down. It can be a little bit of a journey to walk someone through that. But the best thing with metals is that opening up the detox pathways, really having on board detox tools, going slow, and really, from what I found, not high dosages of any supplement, because it's almost as if you ramp up the detox so much that they actually get more fatigue and more symptoms. So I am very cautious with a very serious heavy metal detox. For most of my clients, I try to be as gentle as possible so that they can still, live their life. Because if you're detoxing heavy metals, you need to be able to work. You don't want to be stuck in bed. You need to still be able to function. And if you overdo it on the supplements, you are going to be exhausted.
Sounds about right. Living in Florida, what is your theory on sunlight? What do you think it causes skin cancer? Or what do you think people should be thinking about sunlight in Florida?
Wow, I love this question. So the sun is like literally information for our bodies, just packets of information for our bodies. It's helping our cellular health. It's helping our vitamin D status. It's helping our melatonin so that our body knows when to wake up, when to go to sleep. And so in the morning, if we can get that sunlight, our cortisol increases, our body gets, the energy that it needs from the sun, almost like photosynthesis. And then the sun goes down, our melatonin increases, our cortisol goes down. And when we're living in that rhythm, that circadian balance, to me, that is one thing that we have to protect, is our circadian balance. What can we do to keep a healthy circadian balance? Because that's going to help our stress, that's going to help our immune system. And so the sun is like, it's information for our body. It's information on different cellular processes. I don't think the sun causes skin cancer. I think we've been totally brainwashed to think that the sun is causing a problem with our health. I think the problem with our health is that we're nutritionally deficient. That can cause someone to be more prone to being sunburnt. And then on top of it, you've got all the chemical sunscreens. And so you're cooking the chemical sunscreens into your skin. So I think that is an issue. In Florida, I think some people, before they support their health, they do seem to burn if they're out in the sun too long. And there are natural mineral-based sunscreens if they need it. Or like even in traditional cultures, they wore like loose clothing so that they wouldn't burn. So we've kind of been, I don't want to use the word brainwashed, but kind of brainwashed that the sun is the problem. And the sun is everything. The sun is how our body knows what to do when. I think it's one of the most important factors of holistic health.
It is. And the vitamin D status, even conventional medicine is coming on to that one, identifying how critical it is for survival against the C. We won't say it, we'll get censored here, but even against the C, conventional medicine says 60, you need to have a level of 60 or above, and then you'll be fine. It's so critical. How do you maximize your patients' vitamin D levels?
First thing is getting in the sun. The second thing would be foods that actually support vitamin D production, like the foods that have a lot of fat. So vitamin D is like a fat soluble nutrient. So it can be in, if you're going to cook in lard or egg yolks, pastured butter. So you want to support those high fat foods to get those fat soluble nutrients. Sometimes if there's low vitamin D, I actually need to support their gallbladder. Sometimes their body is having trouble digesting or absorbing fat. Primarily through the sun, there are some lamps, like the red light lamps, that can help produce the vitamin D. And then those foods that have natural vitamin D, sometimes cod liver oil.
Yep, that sounds about right. And what do you think about supplementing with additional vitamin D, like a lot of people are doing that nowadays, vitamin D plus K2, at least 5,000 units a day, 10,000 for some.
So I like vitamin D supplementation as long as it's not too high. And typically if it's short term, so retesting, seeing what their levels are, because a lot of times if they're on these like 10,000 IUs for months and months and months, they're depleting like their potassium and their magnesium. And sometimes with the vitamin D, they have like a metabolic problem where there's something inflammatory in their system, where sometimes we just need to address that. And back like 15 years ago when I was having symptoms, vitamin D wasn't all the craze. So there wasn't a practitioner that I saw that loaded me up on vitamin D. Like no one back then was like, it wasn't like a huge like hot topic. It was more so used like if you had a cold or something. But none of the practitioners that I saw were like loading people up or constantly testing vitamin D. I think now is a good idea to test it. You can just test it and know where you're at, and then, go from there.
I think it's probably one of the most important markers to look for. So vitamin D and the fasting insulin. I mean, that if you're good on those, kind of almost everything will fall into place.
Absolutely. Yeah. The fasting insulin and the blood sugar, the glucose, A1C, I like to see all of those. And from what I've noticed, especially when I see high blood glucose or high A1C, there's a lot of stress in these individuals' lives. There's a lot of stress. There's a lot of their circadian rhythm is totally out of balance. They're grabbing those quick carbs, caffeine and sugar just constantly throughout the day. And you can only do that for so many years before there is going to be a problem with blood sugar and insulin. So a lot of times with those cases, it's more coaching. It's more coaching on coming back to kind of reconnecting their system with nature and what that rhythm is.
It's so hard to do. Like back when I worked in conventional medicine, I was stuck sometimes 8 to 5 p.m. in an office where you wouldn't see the sunlight except for your lunch break. A lot of people live like that. It's so hard. So I struggle how to help these people. They can't escape the fluorescent light for 8 hours a day.
Yeah, it definitely requires a little bit different approach. So we do the best that we can with their nutrition. We do the best that we can with their diet. And a lot of times I will have them set up an appointment with like an alternative therapy practitioner, whether it's reflexology, acupuncture, craniosacral, rolfing, massage therapy, just so we can get their system some stress support on board. And for the most part, whether someone is a busy professional or they're a busy mom or they're like an entrepreneur, they will figure out a way to incorporate nature. They will figure out a way because they've been having their symptoms for so long. They're going to optimize their weekends. They're going to maximize their time off. They're going to make the tweaks and the changes so that they can improve.
Yeah. Yeah. Back when I was a PA student studying in Massachusetts, I was probably I was the sickest I'd ever been there. It wasn't getting any sunlight because of the darkness in Massachusetts. I was stuck doing surgical rotations, 70, sometimes 80 hours a week. You didn't see the light of day. You wake up at 4 a.m. to do rounds. Doing a program like this is absolutely brutal. It's hard.
Wow. So how did you get through that?
I don't know. It was tough. I barely survived it, honestly.
Wow.
Yeah. It was not a good time. I was super sick. Constantly getting like respiratory stuff, skin rashes. My skin was all inflamed.
Yeah.
Psychologically, I wasn't right either. It was not a good time. That's how a lot of medical programs go about things. They push students really hard. But then after that, after you graduate, some people continue to work like that. They do long shifts like that, back to back, 12-hour shifts, stuck in a cave, essentially. Some people would do that 7 days a week, especially in the medical field. They do like 7 days on, 7 days off. But even besides that, the regular shift work in the office, you're 8 to 5, you get a 1-hour lunch break. I think that drives a lot of disease. And I don't know how to fix that, honestly, because it's the way the system works.
Yeah.
Unless maybe the red lights can help. We put red lights in the office.
Mm-hmm. That would be a good idea.
Maybe
So what do you see with the system? Do you see the system changing, more people going into private practice, or what do you see?
Well, right now there's the great resignation going on. Conventional medical practitioners, my colleagues, a lot of them are considering leaving these big institutions for a variety of reasons that have been building up for some time. So understaffing, underpaying, and now with these mandates. So there's a big resignation going on. And maybe people will start going to things that I've created here, like direct primary care, kind of getting away from an insurance system where you can have a little bit more holistic approach to patients, actually get patients better, rather than just trying to see a bunch of patients per day and bill insurance as much as you can. Maybe we'll see more of them. People just walking away, say, no, we're not going to do this stuff anymore. Makes us sick.
Mm-hmm.
Patients aren't getting better. Maybe we'll see some improvement that way.
Mm-hmm.
We can hope.
Yeah, it's a real struggle because people are sick and they're not necessarily getting the answers. And it's like they're on a hamster wheel. They go from doctor to doctor to doctor to try to figure out, why they're sick, when it could be something really simple, but the medical field, it's really easy to get tossed around.
Yep. And, the medical providers themselves are sometimes the most unhealthy, from people I've worked with, I've seen it. No one looks like, you healthy, no one's healthy in the medical industry. We're sicker than sometimes of some of the patients. It's just because the way we've been trained and the way we live. So we have sick people trying to take care of sicker people. And that's how it kind of works.
That's exactly right. That's exactly right. They're just as stressed.
Yep. Stressed, burned out, and getting sicker by the day. Diabetes, overweight, PCOS, you know, high blood
Mhm,
pressure, you name it.
mhm,
It's all lifestyle reversible.
mhm.
So how can people find you if they're interested in learning about what you do or becoming a patient of yours?
Absolutely. Yeah, my website is Dr. Melanie Joy, drmelaniejoy.com. I'm on Instagram, dr.melaniejoy. I'm on Facebook, Dr. Melanie Joy, and they can really contact me through my website is the best place. Right now I have a waiting list, but they can still contact me through there and get added. It's I really took the time to focus on my clients, especially during the pandemic. So I have a list and I'm trying to work my way through it, but they can still contact me and get at it.
Awesome. Sounds great. You're doing great things. Maybe I'll come visit sometime up in the Panhandle.
Yes, awesome. Would love it. Thank you so much for the interview.
Cool. All right. We'll end it right here then. Let's see.